Hello everyone, I am Dr. Swati Mehta and our today's topic is anorectal dysfunctions, especially during pregnancy, understanding the symptoms, causes and holistic management from a clinical and homeopathic viewpoint. So don't miss this informative session. Stay connected and keep learning. Common factors or complications of constipation are described further. Anorectal dysfunctions includes several common yet often uncomfortable conditions affecting the anal and rectal region. This includes hemorrhoids, anal fissure, fecal incontinence, pruritus ani, and itching, proctalgia fucus, rectal prolapse, and anorectal abscess and fissure. Hemorrhoids, also known as piles, and they are very common during pregnancy because of the constipation and also the growth of baby in the womb or uterus that causes pressure on the rectum and that leads to constipation. Hemorrhoids, also known as piles or rectal lumps, are dilated and enlarged veins in the lower part of the rectum or anus. They can cause symptoms like pain, swelling, itching, and bleeding, especially during bowel movements. They are commonly occur due to straining, chronic constipation, prolonged sitting, or increased pressure in the rectal veins. Hemorrhoids are mainly of two types. Internal hemorrhoids, they are located inside the rectum and usually painless but may cause bleeding. They are classified into four grades. Grade 1, that is swollen vein without prolapse. Grade 2, prolapse during straining but return on their own. Grade 3, prolapse and need manual pushing back. And grade 4, that is permanently prolapsed and cannot be pushed back. External hemorrhoids, they are located under the skin around the anus and may cause pain, swelling and discomfort, especially if a clot forms. And this is very common with a pregnant woman. Hemorrhoids develop from a plexus of dilated venous channels and supporting connective tissue in the anorectal region. These veins arise from the superior and inferior hemorrhoidal veins and are located in the submucosal layer of the lower rectum. Hemorrhoids are classified as internal or external depending on their position above or below the dentate line, and in many cases both types may coexist. This picture shows the position of internal piles and external piles and the dentate line. This picture shows the piles where the enlarged or inflamed hemorrhoids present. Watch the picture. It shows the internal hemorrhoids which arise from the superior hemorrhoidal cushion and their three primary locations: left lateral, right anterior and right posterior, correspond to the end branches of the middle and superior hemorrhoidal veins. The overlying mucosa is rectal and innervation is visceral. External hemorrhoids arise from the inferior hemorrhoidal plexus and are located beneath the dentate line. They are covered with squamous epithelium, which contains numerous somatic pain receptors. Internal and external hemorrhoids communicate with one another and drain into internal pudendal veins and ultimately to VCI. Here picture shows different type of hemorrhoids. Classification: Grade 1 hemorrhoids are visualized on anoscopy and may bulge into the lumen but do not extend below the dentate line. Grade 2, if hemorrhoids prolapse out of the anal canal with defecation or with straining but reduce spontaneously. Grade 3, hemorrhoids prolapse out the anal canal with defecation or straining and require the patient to reduce them into their normal position. And grade 4, hemorrhoids are irreducible and may start strangulate. The picture shows different grades of piles. Grading of internal piles or hemorrhoids we already discussed previously. This picture shows different grades of piles, so you can understand when you are observing the patient's piles. General causes are pressure, straining on constipation or severe diarrhea, or constant sitting posture, or obesity and pregnancy. So we are talking about the pregnancy piles. Hemorrhoids are common during pregnancy due to increased pressure on the rectal veins, the growing uterus pressure on the pelvic blood vessels that showing blood flow and causing vein swelling. Hormonal changes also relax the vein walls, making them more prone to dilate, and additionally, constipation and straining during bowel movements further increase the risk of development of the hemorrhoids during pregnancy. Frequency shows how many times or how many people are affected, and it is very common during pregnancy. Hemorrhoids develop due to increased pressure and weakening of the supportive tissues of anal veins, including to their dilatation and swelling. There are theories, varicose vein theory, that suggests hemorrhoids occurs due to enlargement and varicosity of the rectal veins caused by increased venous pressure. Sliding anal cushion theory, that is mostly accepted, that hemorrhoids result from the downward displacement and enlargement of the normal anal cushions due to weakening of supporting connective tissue. So this is you can consider as a tubercular or psychotic miasm. Vascular hyperplasia theory, increased blood flow and vascular changes leads to swelling and enlargement of the hemorrhoidal tissues. Again, this is a psychotic miasm. This mechanism together contribute to bleeding, prolapse, and other hemorrhoidal systems. Common symptoms of hemorrhoids include bright red rectal bleeding, especially during or after bowel movements. Patient may experience pain during defecation, anal itching, that is pruritus, and discomfort. Internal hemorrhoids often causes painless bleeding and prolapse, while thrombosed hemorrhoids can cause severe pain and swelling. In some cases, irritation, mucus discharge associated with rectal prolapse may also occur. So this last two types, that is internal piles and the thrombosed piles, very common in pregnancy because patient cannot able to move bowel regularly or having constipation because of the lack of fluids. Hemorrhoids commonly present with bleeding, pain and discomfort, prolapse, itching and irritation, and swelling and lumps. And this manifestation vary depending on the types, that is internal or external, and the severity. But by these symptoms we can consider these hemorrhoids are belonging to the psychotic miasm. Differential diagnosis of hemorrhoids are anal fissure, rectal prolapse, anorectal cancer, Crohn's disease. But careful examination and history help to distinguish the hemorrhoids from these conditions. These are the tests to be performed and examining the patient. Hemorrhoids can lead to several complications: thrombosis, that is painful lumps, tissue necrosis, surrounding tissue may die and leading to severe pain, severe bleeding that can result into iron deficiency anemia, urinary problems, that is retention of urine or urinary tract infection, and fecal impaction and delayed hemorrhage, that is chronic issue from the prolonged hemorrhoids. Early recognition and management help prevent these complications. Thrombosed hemorrhoid is look like this. So when you watch this picture, you can diagnose easily. Most hemorrhoids can be managed conservatively with preventing constipation, That is, patient has to take high fiber diet, plenty of fluids and fiber supplements, stool softeners to ease bowel movements, but we cannot advise this to the pregnant woman. Symptoms relief for bleeding, irritation, pruritus or thrombosis. We can use our homeopathic medicines. Pregnancy care encourage the hydration, fiber-rich diet and avoid straining to prevent hemorrhoids. This lifestyle and conservative measures are effective for most of the patients and help reducing the symptoms and reoccurrence. For relief of the pain, topical treatments can be advised. Hygiene must be managed. Soothing measures, that is warm sea bath, ice packs or cold compresses for 10 minutes. Dietary support is important. In pain and irritation relief by analgesic creams and warm bath that help ease comfort and pruritus. If prolapse, then gently push back the piles. Use warm sea bath or a cold toilet papers and pressure on that for few minutes. For prevention, we already discussed previously. Only thing is, I want to tell you that use pregnancy safe cream or suppositories for itching and discomfort. And for soothing measures, again warm sea bath, and avoid prolonged sitting or standing and gentle exercise to improve the circulation, especially during pregnancy. These are the general treatments of hemorrhoids in pregnancy. This treatment are for general hemorrhoids, not for the pregnancy piles, but I am discussing here about the general patients. Rubber band ligation, that is tying off the hemorrhoids to cut the blood supply. Sclerotherapy, that is injection to shrink the hemorrhoids. Infrared or laser therapy, that is use heat or light to reduce the hemorrhoid tissue. And electrocoagulation and cryosurgery, that is using electrical current or freezing to destroy hemorrhoids tissue. Keep in your mind that these treatments are not meant for pregnancy piles. These are the treatment for piles in general for male or a female, but not during pregnancy. Sigmoidoscopy is a diagnostic procedure used to examine the lower part of the large intestine and include the rectum and sigmoid colon. A flexible tube with a light and camera is inserted through the anus, and it allowed doctor to visualize the lining, detect hemorrhoids, polyp, inflammation, ulcers or tumors, and sometimes take tissue samples, that is for biopsy. It is less extensive than a full colonoscopy. But again, this is not advised during pregnancy. This is for the general hemorrhoids for male and female, but not during pregnancy. Homeopathic medicines can be very effective in managing hemorrhoids during pregnancy, especially bleeding or prolapse and blind piles. I have had successful results using safe, gentle remedies, helping reducing bleeding, pain, and swelling without affecting the pregnancy. In this video, I will discuss my approach, key remedies, and tip for managing hemorrhoids safely during pregnancy. Aesculus is a commonly used homeopathic remedy for both bleeding and blind hemorrhoids. It is especially helpful in painful, burning, purplish external piles with marked rectal soreness, dryness, itching, and sensation of fullness. So I had already shown the picture of thrombosed piles and different type of piles. From that you can make it out that there is a bleeding or a blind piles but bluish in color. Patient often feels as if the rectum is full of small sticks and sharp knife-like pain shooting upward. So this is a peculiar symptom which is known as the keynote symptom. A key symptom is severe dull aching pain in the lumbosacral region, affecting the sacrum, hips and lower back, often described as bruised or broken. This remedy acts strongly on the veins of the lower bowel and pelvic organs, helping relieve venous congestion, swelling, and varicose conditions, where veins appear purple and puffy. Heat, dryness, stiffness, and lingering rectal discomfort after stool are characteristic indications. So, this medicine is the first to be thought of in case of piles during pregnancy. Collinsonia is a valuable homeopathic remedy for hemorrhoids and pruritus during pregnancy. It is especially useful when there is a pelvic congestion affecting the anus, rectum, and uterus, leading to piles and constipation. It is indicated in women with alternating constipation and diarrhea, sluggish and hard stools, dry, painful, obstinate constipation with protruding hemorrhoids, and hemorrhoids may also alternate with heart, chest, or rheumatic complications. One more thing is this is a peculiar or specific remedy for piles during pregnancy, which is having bleeding piles, and the specific symptom is small sands fill in the rectum like Aesculus. There is small sticks are felt in the rectum, but Aesculus most commonly used for blind piles, while Collinsonia is used for the bleeding piles. And this remedy is also helpful when piles are associated with uterine prolapse, rectal prolapse, heat flushes, and breathing discomfort, particularly in pregnancy related cases. Muriatic acid is an important homeopathic remedy for severe hemorrhoids during pregnancy, especially when the piles are bluish, swollen, extremely sensitive, and very painful to touch. Even slight contact, like bed sheets, may feel unbearable. It is indicated when there is intense burning, stitching pain, and marked soreness, often with prolapse of hemorrhoids, while urinating or passing flatus. Patient may feel extremely weak, tending to slide down in bed and feel better by lying quietly. Associated symptoms may include dry mouth, throat, irritability, restlessness, and general weakness, making it useful in more severe and painful hemorrhoid conditions. Ammonium Mur is a homeopathic remedy that acts mainly on the mucous membrane and circulation, often causing congestion and increased mucus secretion. It is indicated in hemorrhoids with soreness, burning, and stinging pain in the rectum, especially lasting for hours after stool. Stool are typically hard, crumbly, difficult to pass, sometimes covered with mucus and may vary in color, consistency. Constipation may alternate with mucus diarrhea. Patient may experience itching and soreness around the anus, stinging pain in the perineum, and emotional symptoms like feeling, crying, but unable to do so. This remedy is useful in cases with marked rectal irritation and irregularity of the bowel. Capsicum is useful homeopathic remedy for bleeding hemorrhoids with marked soreness of the anus, along with stinging, burning, and smarting pain, especially during and after stool. It is often indicated when hemorrhoids are associated with acid dyspepsia and burning sensation in the mouth, throat, and stomach. So sometimes patient may have only acidity and patient may not have hemorrhoids, but we can use capsicum for that also. Patients are typically chilly with pain, often starting in back and severe backache that may alternate with heat and swelling. These remedies act mainly on the mucous membrane, which may appear dark red, spongy, and oozing bloody mucus. Emotionally, patient may be irritable, easily offended, moody, and restless, sometimes showing alternating laughter and weeping with disturbed sleep. So, patient is moody. This symptom is also important and keynote feature of capsicum. Lycopodium is commonly indicated in hemorrhoids associated with chronic digestive weakness and liver dysfunction. Symptoms usually develop gradually with poor nutrition, low vitality, and weak circulation, often with cold, numb extremities. So this medicine we can use where the digestion is very poor. Patients typically have gas, bloated acidity, and loud flatulence with a sensation of fullness after eating even small amounts. Constipation is common with ineffectual urging, feeling that stool remains incomplete, and rectal contraction or protrusion during stool, leading to hemorrhoids. So here, prolapse of rectum rather than the hemorrhoids. It is especially useful in hemorrhoids occurring after childbirth. So it is used for multipara or when symptoms worse away from the home, or that is in primipara, because the patient married and within 1 year or 2 years she become pregnant, she may develop this condition. The piles are usually painful to touch and may improve with warm or hot application. Pulsatilla is a well-known homeopathic remedy especially suited for women with changeable symptoms and digestive disturbances. Patients are usually thirstless with gastric problem after eating rich, fatty or mixed foods, often leading to constipation and hemorrhoids. It is indicated in blind hemorrhoids with itching and sticking pain in the rectum, along with irregular stools that vary in nature. Patients may feel abdominal pressure, bloating and rumbling sensations. Emotionally, pulsatilla patients are typically mild, gentle, emotional and weepy, often feeling better with sympathy and consolation. Symptoms are frequently associated with hormonal changes, especially beginning around puberty, and may be accompanied by chilliness, shortness of breath, and numbness of extremities. Nux vomica is commonly indicated in hemorrhoids associated with severe constipation and frequent but ineffectual urging for stool. It is often suited to the individuals living a sedentary, stressful modern lifestyle with digestive disturbances. Patients typically experience repeated desire for stool with small unsatisfactory evacuation, sometimes alternating with diarrhea. Hemorrhoids are useful in case of itching blind piles, often relieved by cold application or cold bathing. Thank you so much for watching this video. I hope you found this discussion helpful and informative. If you like the video, please don't forget to like, share and subscribe to the channel for more educational content. Your support and encouragement means a lot. Feel free to share your questions or feedback in the comments. Thank you for being a part of this learning journey.